The Kovai Post, news delivered.
Welcome to this edition of Kovai Post, and I'm Dr. Karthik, the orthopedic surgeon in Coimbatore, Global Ortho and Trauma Hospital, Ramnagar, and we're going to talk about arthritis. Arthritis is one of the commonest conditions that happens in old age for the cause of pain, and we often see arthritis in knee, hip and spine joints. Nevertheless, it can happen in almost all the joints, but one of the most common joints which is currently dealt is with the knee joint. So we'll talk about knee arthritis. Arthritis is something that we don't have to be alarmed about, but we should take precautions, which is most important to prevent this thing from happening. Now, the most likely thing is it starts off from the age of 40. Most important thing is an active lifestyle and maintaining one's body weight in appropriate limits and avoiding compounding exercises to be started above the age of 40 or 45. Most of the time these patients complain of pain, swelling, stiffness and reduction in walking distance. They also have clicking and crackling noise inside the joints. They also get sleep disturbance because of pain. Once they get this pain which disturbs their sleep, which is called night pain, most of the time it is quite bad, and they have to see a doctor earlier than late. Many a times when they get up and walk, they complain of pain, and after walking few steps, the pain gets better. In these circumstances, they need to do some exercises to strengthen the muscles around the knee joint, so that when they stand and walk and stand up from sitting position, the weight that goes through the joint gets shared a bit and the pain gets little easier. Now, that's one of the most important things. The second thing is they have to avoid smoking. Weight reduction is one of the important things, and a constant exercise program which helps them relieve pain. Most of the time in the early stages of knee pain, where there is some amount or a minimal amount of wear and tear, it's very important that they start off with exercises, and non-operative measures will help them. Once it gets little worse and it is moderate amount of arthritis, simple exercises and lifestyle changes won't help them. Then they require some medications on long term and a definitive exercise program to help their knees. In severe arthritis, they will also see deformity of the joints. There is restriction of movements. They can't sit on the floor, they can't squat, and there is severe pain on all the times. And this is a condition when they will find it difficult to even walk few steps. And severe arthritis needs operation. Operations are of two ways or three types. Realignment procedures are done when patients are young and if it's not involving the entire joint. If it is not so bad and when there's lots of bits of debris and loose bodies inside the joint, there's something called as an arthroscopy, which is a keyhole surgery to wash up the joint, and this gives a temporary relief of pain. This keyhole procedure is to buy time before they end up in a total knee replacement, and the definitive procedures are total knee replacements, which gives them long-term pain relief. If you think you have knee pain, do not diagnose it as arthritis by yourself. Please see your local doctor. Thank you.